Many of us unwind with a glass of wine after work, but alcohol is a major risk factor for head and neck cancer, as is all tobacco products. But on top of that, 70% of cancers in the back of the throat are linked to HPV. That's according to the CDC. So joining me now is Dr. Paul van der Sloot, a surgeon with the Head and Neck Surgical Specialty Group at Swedish Medical Center. And tell us first, how does HPV cause head and neck cancer?
So viruses in general integrate into host DNA and genes, and that's how they upset kind of the body's way of controlling replication of cells and things like that. So cancers are basically uncontrolled replication of cells, and viruses, HPV in this case, can kickstart that process.
All right, and tell us too some of the warning signs of head and neck cancer that people should know about.
Sure. I think everything depends on site, but the things that are kind of in common with many of them are people having a chronically sore throat, for example, doesn't go away or continues to get worse. And we're talking over a period of 2 to 3 weeks. If we kind of extend beyond that, we get concerned. If you have blood in your mouth or cough up blood, that's a really important risk as far as symptoms are concerned. Some people will develop changes in their voice, again, prolonged. Again, when you get above that, again, 3 or 4 week hoarseness stage, you should have that evaluated. Those are kind of the main ones. Difficulty swallowing, loss of weight can be part of that as well, but those are the main ones.
All right, thanks. Tell us too, if you are diagnosed, what is the treatment or what does that look like?
So again, a lot depends on site. If we're speaking specifically about the HPV-related cancers in the oral pharynx, those can be treated in a few different ways. I guess the first thing to say is that generally the prognosis is quite good for the HPV-related cancers, better than those that are not HPV-related. And that treatment can involve surgery up front, and sometimes only surgery, but also surgery followed by radiation or even chemoradiation, depending on what the pathology tells us about the tumor. The other issues that we have, the other way we can treat these cancers is to treat with primary chemoradiation therapy. So there are certain cancers that are probably better treated with chemoradiation than surgery. And really what we're firstly trying to achieve is cancer control, and secondly, trying to achieve the best functional outcome we can get for patients. So those are the deciding factors on what route we would go as far as treatment is concerned.
Interesting. And is there ways to prevent head and neck cancers?
Well, I think you've spoken a little bit about the risk factors, smoking, alcohol, and HPV. I think those are probably the key elements to think about. Obviously, I think it's pretty common knowledge at this point that we shouldn't smoke. That's not just a risk factor for head and neck cancers. The risk of smoking and the risk of alcohol, rather than just adding the two to one another, or like multiplying the two in terms of your overall risk. So the combination is really a bad one. So avoiding those, that's important. And of course, the HPV vaccine is now available, and that's a really important thing for, I think, the general public to kind of latch onto and take part in. Initially when they came out, it was primarily young women and girls who would get that vaccine, but very quickly now that's moved on, that all men and women, girls and boys should be vaccinated.
Wonderful. Is there anything we haven't talked about that you think it's important for people to know about?
I think that the key thing is when you have persistent symptoms in your throat, areas that you can't see very well on exam, I think it's really important that first of all, you establish care with a primary care physician, and you make that connection with them. The dentist can play a big role in this as well, having regular checkups that way. They can all help, but those persistent symptoms that might not show up on just a routine physical exam, you're going to want to kind of persist in getting that evaluated, because again, you might not see it just on a routine physical exam.
Wonderful. That's some great advice. Well, thanks so much, Doctor, for your time. We really appreciate it.
You're very welcome.
We'll be right back.